We'll answer a question that always brings about disputes between radiographers and hospital staffs. Okay, so some hospital staffs, when they want to send for request for imaging for a particular patient, the request book usually is to have little details. You understand? They don't want to give the radiographer a lot of details, so to say, they feel as if they are doing the radiographer a favor, by giving them much details. So here is actually I'm trying to give a reason why the request should be detailed, and most importantly, we're trying to look at the area to be imaged, why the area to be imaged should be clearly specified. So this is an example of a radiology request form, and you could clearly look at the various areas that have been provided for information. So in radiology, you have to be accurate. Do you understand? Maybe a patient has a problem with their hand. You have to indicate that, okay, this patient has issues with their hand, so that this radiation, they don't go putting it all over the body of the patient. Do you understand? So diagnostic accuracy. So imaging the wrong area can miss the disease condition totally. So you don't want such an issue. Then clinical indication is it ensures that the radiographer targets the region of clinical interest, producing images that answer the physician diagnostic question. Then you also avoid unnecessary repeats. So radiation safety is radiography involve what? Analyzing energy. So you want to be accurate, and you want to just expose this patient to the amount of energy that is just needed for a particular time alone. So workflow efficiency. Ambiguous requests can cause delays, while radiographers, they seek clarification. Okay, so clear instructions make sure that the process is just straightforward and it's time saving for both the patient and also the radiographer. So it also reduces the risks of errors and all of that, wasted resources, making the patient come back again for imaging. So legal and professional responsibilities. Radiographers are legally bound to perform only the requested procedure. So they follow only the instructions that the doctor is giving them. Yes, they could know that the instruction is incorrect, but they just still have to follow. Do you understand? Because if there's any law cases coming up, they work under the doctor, so the doctor is the one that has to handle such cases. Do you understand? So the doctor just has to give very clear instructions, and this also helps in patient cooperation, and it helps that the patient is just exposed to the amount of radiation that is just needed for that particular procedure.